Hi, everyone. Welcome to an exciting edition of Ask Dr. Dansinger with world-renowned diabetes reversal expert, Dr. Michael Dansinger with diabetesreversalpartners.com. He is making the announcement today, which I'm so excited about, um, which is he is officially joining our team. He's been helping us out so much with our weekly sessions and with our book, our Food for Thought book, which is available on Amazon, which offers a great jumping off point for people who have diabetes and peripheral artery disease to work with their doctor and a dietitian or a nutritionist on customizing an appropriate dietary care plan for your situation. But we decided that we would love to have Dr. Michael Dansinger as our Chief Medical Officer for the Global PAD Association because diet plays such an integral role in lighting your arteries on fire and then conversely healing the arteries that are on fire. And so we wanted to, instead of just having a vascular specialist as our chief medical officer, we want to get to the root. We want to help people at the source of what's literally causing the fire in the first place. And a lot of it comes down to diet, right, Dr. Dansinger?
Absolutely, 100%. Kim, I am honored and I wholeheartedly accept the opportunity to be Chief Medical Officer of the PAD Association.
Thank you. And in considering it, why do you think it's really important for, and I know I touched on it, but why do you think it's so important for the chief medical officer to not just be a vascular specialist, but to be someone who specifically focuses and specializes in diabetes reversal and also healing the arteries that are on fire?
Yeah, absolutely. So, PAD is a vascular disease, and the root cause, we want to be as proactive as possible. We don't want to just be there when it's an emergency situation and we're trying to prevent a limb amputation. We want to prevent vascular disease in the first place. And so PAD is largely preventable. At least, perhaps up to 80% of the amputations could potentially have been prevented if we were better as a system at preventing and addressing the root causes. A lot of it is the food. And a lot of it is preventable risk factors, like helping people figure out how to avoid smoking and how to lower their cholesterol and how to lower their blood pressure and other cardiovascular risk factors. And we need to be very good at preventing and dealing with the root causes.
Yeah.
Nutrition is my expertise, and I'm proud to do whatever I can to use my nutrition experience to help prevent vascular disease.
No, it's really huge. And one of the issues I think I saw a statistic that I included in our press release that 78% of people who have PAD are considered malnourished. And that's a really big problem. And I think that that supports this proactive effort that we're making to add you and to have weekly opportunities where patients can come and learn and be able to ask questions about dietary information.
Absolutely. So it's not that Americans are lacking in calories in most cases. It's that we're eating the wrong foods. We're often, we, um, there's never been a better opportunity to nourish ourselves properly with a wide range of vegetables and fruits and healthy proteins. But it's harder than ever to avoid the treats that we know are unhealthy, things that are, that we see advertised on TV. And so, um, it's not easy to make healthy choices, but that's what we need to do.
And our system really does need help right now with this type of information because we all know we should be eating better. Your doctor tells you to eat better. It's so easy for them to say, you need to eat better. You need to eat better to lower your A1C. You need to eat better to lower your cholesterol. You need to eat better to lower your blood pressure. But what does that really mean? You go into a dietitian and you might, if anything, you might be lucky enough to get one appointment with a dietitian, right? Maybe two, in the course of a year, or a nutritionist. You may be lucky enough to get enrolled in a cardio rehab program for 12 weeks. But what happens for the rest of the year is you're making choices in real time. It's very, very difficult for patients to maintain these healthy diets and sort through all of the daily challenges in trying to eat better for artery health more consistently. And that's really where we're hoping that you can come in.
Yes, absolutely. I have an important role to help the Global PAD Association help bridge that gap between knowing what to do versus figuring out how to do it consistently, day after day, week after week, month after month. And so many people wish that the healthcare system would provide more support and accountability and structure and encouragement to do the right thing, to figure out how to eat and how to socialize and how to live a normal, enjoyable life without letting unhealthy food ruin it for us.
Yeah. And so, what is your mission? What do you hope to accomplish as the chief medical officer?
So, thank you for asking, Kim. So, as the Chief Medical Officer, my mission is threefold. Firstly, I want to help raise awareness of the silent PAD epidemic to bring national and global attention to peripheral artery disease as one of the most underdiagnosed, undertreated, and misunderstood cardiovascular conditions, and to elevate the Global PAD Association as a trusted source of patient centered education, advocacy, and support. Secondly, I'd like to help improve the healthcare system's response, to help shift the healthcare system from reactive amputation care to proactive limb preservation by championing earlier detection, equitable access to care, and greater clinical integration of prevention, revascularization, and rehabilitation strategies. And I'd specifically like to work with the American Heart Association and the American Diabetes Association and other associations who have a similar mission. And thirdly, to help deliver evidence-based nutrition and lifestyle guidance to provide both clinicians and patients with practical, science-based nutrition and lifestyle tools that complement medical and surgical care, empower people with PAD to protect their limbs, extend their lives, and improve their quality of life.
So, what does this look like, specifically for you?
Well, Kim, you've started and built up a tremendous library of educational content that complements clinical care, and I'd like to help you build on that. You've done a lot of great work translating nutritional research into accessible, actionable language, so I'm going to help with that and help patients apply the general heart healthy principles specifically to their own situation and help offer just a wide range of insights and expertise to you and your excellent team. And I'm looking forward to that opportunity. There's so much that we can do, so much that needs to be done, and I'm excited to dive deeply with you to help make an even bigger difference than you already have.
And I want it for people that might be concerned and say, "Whoa, wait a minute. Well, we have our own healthcare teams. We have our own dietitians. We're not here to give medical advice. We're not here to replace. We're here as, adjunctive support for the patients to be able to answer questions in real time, to be able to explain further. We just want to help where their healthcare teams are really leaving off, where patients are jumping and diving into Dr. Google and diving into Chat GPT and helping to make sure that they're looking to the right and finding the right educational resources and are interpreting the evidence-based information, right, in the proper way in which their doctors are intending.
Absolutely well said. So I'm a doctor. I'm not your doctor. We are here to help you to navigate the healthcare system to get the most out of your treatment plan with your healthcare team.
And so every week, aside from the book, we're going to be revising our Food for Thought book. Not sure on a release date yet for that. It's already available, and it's a fantastic book that Dr. Dansinger really led the way and breaks down what really sets your arteries on fire. And he talks about uh, the blood work that you can get to really get to the root cause so that your team can better customize your diet. There's so much great information in there, but we're hoping to expand to include additional information in it as well as we go along. But we have our weekly Q&As. And what do you hope that people, if they're seeing this, the patients, you want them to show up every single week? What's the benefit of showing up every single week on a Monday, just as if they were going to their own dietitian for 30 minutes every Monday? How can they benefit from showing up right here on our YouTube channel?
Sure. So it's a learning opportunity, of course, but also an opportunity to help participate in and strengthen the community of like-minded people. And so we spend a lot of time about talking about nutrition. There's a lot, the internet is a great place to get nutrition information, but it's also a place to get confused about nutrition. And so we have an important role in helping answer, cut through the confusion out there, because we can provide a lot of clarity when it comes to nutrition, also around cardiovascular risk factors, thinking through the pros and cons of certain medications, how to interact with others and draw support from family and loved ones and friends, and to also inspire people to be leaders in their neighborhoods and communities and families, and making a positive impact for them. And so that's the kind of thing that people can expect when they participate in our weekly webinars.
And what's incredible is that your practice as well is growing across the country, and you're able to ultimately in multiple states right now. I think Virginia, Minnesota, New York, New Hampshire, Massachusetts, and Florida right
Right.
now, and continuing to grow and expand. Patients who are on Medicare and Medicare Advantage PPO plans have access to weekly support for diabetes reversal through your diabetesreversalpartners.com as well. And this could be adjunctive to even that, showing up every Monday, with additional questions for you so they can sign up for your program and have some additional time to learn even more.
Yeah, thank you, Kim, for mentioning my program, Diabetes Reversal Partners. So in multiple states, I work with patients, all over the United States to provide encouragement and support and real lifestyle coaching for diabetes reversal. A lot of my patients have achieved remission of their type 2 diabetes, being able to eliminate diabetes medication and have normal blood sugar. And a lot of my patients have been able to discontinue insulin and reduce their medications. And so I believe in the medications, but I also believe that no one should be on any more medication than they truly need. And so that's why a lot of patients come to me, and I bill the insurance, and it's a win-win all around.
And so, for those who wonder, well, how in the world did you get into this? Why nutrition? What's your expertise? As we close out here, this incredible announcement, so excited to move forward in partnership with you officially. Um, but what is your experience here, and why are you so passionate about this?
Yeah, thanks for asking. So, over 25 years ago, I finished my training in primary care internal medicine. But then I wanted to get into disease prevention because I could see that the healthcare system in the United States is terribly broken. And patients all over the nation are not getting the attention and the support that they need. We have all these preventable diseases, and the healthcare system has really let us down. And so I got training in nutrition research at Tufts University in Boston, and I've done a wide range of lifestyle related work, and I have 25 years of experience in disease prevention and reversal with specific nutrition coaching training. So it's the practice of my dreams. I love what I do every day. It's the best way to practice medicine, in my opinion. I love helping people reduce rather than increase their medicines.
Fantastic. Thank you so much, Dr. Dansinger. I'm so excited to continue to work with you. And, if you want to join, make sure every single Monday, 3 to 3:30 Eastern time. It's a great opportunity. We want to start making sure every single program is just filled with your questions, helping you to apply what your doctors need you to do in order to improve your artery health, lowering that blood pressure, lowering cholesterol, and especially lowering that A1C. Make sure to email info at padhelp.org, and we will get you signed up. We will get you on the calendar invite for every single week right here on our YouTube channel. We'll make sure that you join us and could get the help that you need to improve your quality of life.